presenters will better help us understand our engagement efforts through the lens of relationships. They're going to discuss how technology and policy that we are developing today are directly affecting the methods by which engagement between Colorado's health providers, insurers, and consumers is facilitated, and the level of personal control an individual or community feels over their own health outcomes. We've got a terrific speaker and moderator today of this morning's panel. Lygeia Ricciardi is the director of the Office of Consumer eHealth at the Office of the National Coordinator for Health IT, ONC. She is responsible for leading the development and implementation of ONC's national strategy to engage consumers in their health and healthcare via information technology. Before joining ONC in 2011, Ricciardi ran Clear Voice Consulting, which specialized in consumer eHealth. She was also a director in the health program at the Markle Foundation, a policy advisor at the Federal Communications Commission, and a content manager at a .com. She's also had been affiliated with Harvard Business School. So, Lygeia, welcome, and thank you very much.
Thank you so much, Anne. I'm going to follow on your theme of sharing a few photos from the family album. So what you see on the screen is my daughter, Ada Rose, who was born with something called a VSD, which is basically a hole in her heart. And my husband and I spent the first year of her life in and out of doctors' offices trying to figure out how much of a problem this was, because it was impacting her growth. And we had some doctors that were encouraging us and her to get open heart surgery in order to close it. But that's kind of a big deal, and it was a very stressful first year. And given my job and my background and this idea of patient engagement, I used the internet and other resources to find out everything I could about this condition, and also to understand the primary issue was her weight was too light, essentially. So we would carefully track her weight using a hospital-grade scale and graph it against kids, not only in the US, but in places like France. Well, it turns out that for American babies, she's dangerously light. But relative to, say, French babies, she's right on target. So, I mean, not to make little, she did have a serious health condition, but when we got the recommendation that we go ahead with open heart surgery, we decided against that. We sought a second opinion, and this is Ada last night, actually, here in Colorado. She's 4.5. She hasn't had surgery. And she's doing really well. The hole is smaller, and we're told, at least for now, that she should be able to live an entirely normal life except for avoiding deep scuba diving, which I'm figuring is probably okay. Like, I haven't done that, and like, I'm good. So scuba diving, open heart surgery. Anyhow, the point is we not only saved a lot of potential risk and trauma, but very possibly $100,000 or so to the health system. And that was really through being engaged parents, caregivers. And so that's an example of what patient engagement means to me. I wanted to talk about engagement more generally here for a moment. And engagement in the health system and the health context really touches on so many types of organizations and people, as you know. Even patient engagement means not only engaging with, say, a doctor, but engaging with family members, other kinds of healthcare providers. But as you know, health and healthcare is very much a team sport. Again, building on what Anne said, you have so many players in this community: policymakers, government, foundations, absolutely. Not to mention within the health system itself, health plans, pharmacies, different kinds of provider organizations of many kinds. And they all need to work together to make healthcare and health successful, certainly communities as well. And technology is, for me, one common theme that can help to enable this kind of collaboration. So I get tired of people asking, is technology, and is healthcare technology in particular, is it a good thing or a bad thing? Well, it's just a tool. It's kind of like saying, like, is fire a good thing or a bad thing? Well, when you're like roasting a steak, it's a really good thing. But if your house is on fire, it's a really bad thing. And similarly with technology, you can use it for good, you can use it for ill, and you can use it certainly to link and build relationships and partnerships. But I also like to think of it, particularly in the patient arena, as something of a Trojan horse. Because while you're helping people communicate better than they did, you're really also changing relationships potentially in a very good way if you apply it well, and enabling people to be much more empowered and engaged real members of their healthcare team, as opposed to just kind of separate pieces who aren't linked together in a common whole. So why is healthcare technology really important now at this moment? To my mind, we're in the midst of a perfect storm, if you will, in which technology itself is better, cheaper, and faster than ever before. Increasingly, we're using sensors. This is related to the explosive growth of mobile technologies, really among all populations, increasingly. Social media is part of this. It's about empowering people. Many people are out there, not only in the health context, sharing information, but it's so commonplace now, obviously, to be part of online communities, buy your own plane tickets, all these things that we didn't take for granted 10, 15, 20 years ago. In addition, there's the whole policy side of change, which some of my colleagues here will talk about more. But obviously, health reform is huge, and it's going to really pave the way, I think, for greater patient engagement. We have something called meaningful use policy, which is what my office, ONC, works on, along with CMS, which is a multi-billion-dollar program which provides incentives for healthcare providers to adopt and use electronic health records. And this is an amazing avenue for change in the patient engagement arena. One of the things we'll do, I'll talk about this in a minute, but we've built into these incentive programs the requirement that patients be able to get their own health records directly, rather than just having doctors share information among themselves. So all that is also supported by modifications to HIPAA. Many of you probably are very familiar with HIPAA as the law that protects your privacy, which it is, but many don't appreciate the extent to which it also really enables access to information. There's a requirement in the HIPAA privacy rule that people gain access to their own health information directly, and specifically there were modifications to that earlier this year that said, if it's in electronic format and you want it that way, you can get it that way. So that's pretty empowering. So I come from the HHS, the government perspective, and I wanted to underscore for you guys that this idea of engaging, especially patients and families, is very built into the broad brush strokes of what the leadership is trying to do. There's something called the National Quality Strategy, which is put out to apply to the whole country, obviously, and one of the big goals is ensuring that each person and family are engaged as partners in their care. To me, what that means, and in the sort of patient engagement in the eHealth or health IT arena, is we have a special role. I don't really think about government as in a top-down kind of way, like let's tell you how it is and get you all to engage. I really think of government as a catalyst, a convener, a coordinator. Obviously, government plays many roles depending on what part of it you're talking about. Government can be a policy setter, an enforcer, et cetera, a legislator. But within this arena, and particularly within my role at this office called ONC, a lot of what we did or do, we really approach with humility in this area, in that we think that real change in patient engagement comes from the outside, and not only from patient and consumer advocates, but also from a lot of other, again, back to this partnership idea of lots of hands coming together. There are a lot of folks who are pushing this forward who come from other arenas. For example, the technology developer arena. There are a lot of folks who are, and we'll hear from some folks who represent that in a minute, but really supporting patients and consumers in being more engaged by giving them the tools to do so. So the way we thought about framing our actions is through something that we call the 3 A's approach. It's got 3 parts, and this is how we sort of help ourselves think about organizing change in this massive arena of possibility. So the first A is about access to information. That ties back to meaningful use and HIPAA, and let's get data flowing to people. So it's about you yourself getting access to your own health records. That's the big essence of that piece. The second A is about action. And this really recognizes the role of developers and entrepreneurs, and basically it's based on the premise, so what? If you get a copy of your health record and you can't really make sense of it or do anything with it, who cares? So let's make it actionable. And in order to do that, we need this partnership with the private sector. So we want to support that private sector partnership by building standards that they can use to build tools so they can really help people make sense of data in ways that are very personalized to them. The third piece is about changing attitudes. And that really recognizes that we're talking about a cultural shift when we talk about engaging patients and consumers. This isn't just about building pipes or building cool apps. It's about changing the way people think about themselves relative to their own health. And I'll say, even in my experience with my daughter Ada, it was incredibly hard for me to say to a cardiologist who was saying, your daughter needs open heart surgery, sign up. It was so hard for me to push back and say, that doesn't feel right. I'm sorry, I'm going to get a second opinion. And she actually said, why don't you try my partner in the same hospital? And I was like, I'm going to get another opinion, because I want a different opinion from a different perspective. But that was a very awkward and difficult conversation. And I'd love to get to a place in which there's more of a shared sense of not only caring about the input from patients, but caring about real data and experiences from their daily lives that they bring to their own picture of their health and healthcare. So it's not just the doctor is advising the patient and the patient is saying yes or no, but it's really more of a two-way conversation. So as an example of all this work, I want to highlight something called the Blue Button Initiative, which is something that we've been leading at ONC, but is really a broader public-private partnership. So if we could run a very brief video, and then I'll tell you a little bit more about it.
You are the keeper of your family's healthcare information. You know the prescriptions, the appointments, the test results. You may be called upon day or night to accurately remember and report every single detail. It's your responsibility to keep the health data for yourself, your kids, your parents, Great Aunt Emma. They all rely on you to remember it all. What if you were unavailable when your mom needed it? What if your child had an emergency and the best treatment was delayed because some vital information wasn't at your fingertips? Now, with Blue Button, you can have reliable online access to your family's health information anytime you need it. Your health information is available now, and you have every right to access it, check it, use it, and share it when you need to. Visit healthit.gov/bluebutton and take control of your health. With Blue Button, the power of your health information is in your hands.
So this is an example of a public service announcement that we at ONC and HHS put together. This is one of several that are geared towards several different audience types. There's another with, they're geared toward different audience types. This is primarily kind of caregivers, particularly mothers, but there are some that are geared toward older populations, folks with chronic conditions, people who fit different gender and racial and age stereotypes, or types, I shouldn't say stereotypes. But anyway, it's a brief introduction to the Blue Button Initiative, which is really at its essence about this access piece. It's about you getting access to your health records. So Blue Button, symbolized right there, is a symbol. It's really about, again, this patient empowerment thing. It's about you getting access to your own health information, which could be your health records from your doctor, but there are other ways too. It has to be electronic. And the key thing is that it's for you. This is not just generally health information exchange. People are sharing information about you on your behalf. This is you getting your own information. And it's built on some national standards. It's not, and this is sometimes confusing to people, it's not a product like a personal health record that sits there in the cloud and stores all your information. It's not a national database. And as I said, it's not about just doctors sharing among each other. It's this initiative supported by several different activities that include a strong public-private partnership, a set of recommended national standards, and some direct-to-consumer or public outreach and education. So this Blue Button Pledge program, as we call it, now has more than 500 members. It was started in 2011, and the members come from, again, think back to all those hands of relationships in healthcare. They represent really many pieces of that, including healthcare providers and hospitals. When they sign up to be part of this program, they're saying, I'm going to make it easy for you to get your health information, and I'm going to follow certain guidelines to make it so. Health insurance companies are also sharing data. So in other words, it's not just clinical data, but it's also data about claims and what was paid. There are other folks, pharmacies now, and we have some of the most influential, far-reaching pharmacies in the country, Walgreens, CVS, Kroger, all those guys signed on and committed to use Blue Button and put the Blue Button symbol on their work and to say, okay, this is where consumers can get online and download their information. We're really excited about that because pharmacy data, what medications you're taking, is in some ways a very easy and perhaps the most potent part of your health record for many people because it changes often. Your health history may not change that much over time, but medications tend to change pretty often, and it's critical for people to know what meds they're taking and to be able to share that data with others. Labs are also sharing data, and then there are other kinds of entities that are also part of this pledge program. So for example, IT developers, Microsoft Health Vault, are saying great, we're going to take this information that is now increasingly flowing from all these data sources, and we're going to make it easy for people to store it and use it. What are people going to do with it? One thing is just to check it for correctness. Is it right? Are there things missing? Are there things that may have been inadvertently, mistakes or left out? Another key thing people can do is they can act as their own care coordinator. They can share their health records with other people. But they also can, using a lot of new and developing apps and tools, really build, work with programs that help them to set and meet their own personal health goals. So that might be something like training for a 5K, or maybe it's managing your diabetes. But in any case, if you can pull from that data about what drugs you're taking and your health history and so on, you can have a much more personalized experience in managing your health. Again, in partnership with some of these tools that are being made available through the private sector. Lastly, and certainly not least, there are a number of consumer advocacy organizations, folks like AARP and the American Cancer Society, who are also working with us to get the word out to patients. This is a good idea. Get your information. Be engaged. Here are some opportunities to do so. So we estimate that today, more than half of us, and that's probably a really conservative estimate, can get some of our health information electronically via these Blue Button partners today. A lot of us don't know it, though, and that's part of the problem. That gets into this attitudes and understanding piece. I want to move on from the access, I think about all that part as access, to the second A, supporting action. So again, as I mentioned, we've put forward a set of recommended standards to support these activities. And we put together these standards, not just in some back room at ONC, but by pulling together 68 volunteer organizations who hammered out what makes sense. And essentially the standards guidelines that we chose, they're existing national standards, and they really tie into other programs such as the Meaningful Use program. So they're not kind of out of the blue or a lot that's very new or different, but they kind of pave the way for consistent sharing of structured health information. The other thing that we did, or another thing that we did, to encourage the participation of the private sector in all this work is we put out, we go or create developer forums in which we talk people through these opportunities, but also seed challenges, which usually have a monetary award associated with them, but they put out a particular problem. One was, let's take the recommended standards for types of information that should be used in sharing Blue Button information, something called the CCDA, which is basically includes your medication list, your health conditions, some basic demographic info. How can you represent that to regular people in a way that is compelling and understanding? So that picture up there with the 84 is kind of a snapshot of, just so you can get a sense of, it's like a sense of design. It's something that's easier to read than your average health record, something like a dashboard you would have in your car. But the idea was, let's create ways for people to visualize information and then put them out there in the public domain so that app developers can use them. So I want to move on to the third of the A's, the attitudes piece, and talk about what we're doing there. One thing is we decided, given that it seemed like there was a real value, I should say the Blue Button Initiative actually had its roots at the Veterans Administration. Back in 2010, the VA put this blue button symbol on its patient portal, and a lot of vets used it to download their records. And it really caught on, and a lot of other folks started picking it up. Aetna, United, people who weren't even necessarily in the same business areas. So together, folks in the federal government, the VA, the White House, the Department of Health, who said, gosh, we're onto something. It's both the idea of sharing data with patients and the idea of calling it something, because this is a social change, this idea of you getting your health information and doing stuff with it. We decided to call it, Blue Button, using this consistent symbol. And that's, I think, really consistent with some other symbols that sometimes transverse different types of products. So just as the Energy Star symbol, for example, could be used on a refrigerator or on an air conditioner, and it means to the consumer, this is really something that's socially responsible, is thinking about energy use. Similarly, if you see the blue button symbol somewhere in the healthcare arena, it's like, oh, this is about empowering me and I can get my information here. So that's why we decided to use this consistent symbol. And we've been working with folks in the pledge community, again, this public-private partnership, to run public service announcements like the one you saw. And there's going to be a real surge in running those starting actually September 15th. There will be a kickoff of this campaign in which we have a lot of organizations doing this. And what we want them to do is to build Blue Button into their own public messaging about engagement and access to information. So we're giving them a lot of leeway, like use your own messaging and build in this consistent symbol so that we can all tie back to it. We also have this, I think, really cool website, which we're going to be officially launching again in September. It's called the Blue Button Connector. And the problem it solves is, if you're somebody who hears about Blue Button and you're like, oh, that sounds cool, I wonder if I can get my data. How do I know which of my providers or pharmacies or others may provide access to information? You can find out here. So it gives you the opportunity to walk through different buckets of data providers and find out, like, where are they in terms of offering information to me? Which is great because right now, it's very hard to sort of start that process. Where do you begin? Now I understand that the Blue Button Connector is really, this is a lot more work than the average person wants to put in. Some people who have a chronic condition, for example, may be totally motivated to do this. But your average Joe or Jane, who maybe is like 20-something and thinks they're invincible, is not going to bother with this right now. This is an interim step, moving the industry toward a place where eventually you'll be able to have programs like, for example, Mint.com. Anybody here use Mint.com? Okay, some do. The idea is it's like one place that you can sign up for and you can authorize it to pull your financial data from lots of different sources, aggregate it and make sense of it and make recommendations to you about how you might save money. I'd love to see something like that exist for health. And by providing linkages to all these different sources of information and encouraging all these data holders to use the same data standards, we're like paving the way forward for that kind of system to exist or that kind of product to exist in the near future. So big picture, let's look at the 3 A's and kind of where we are. I'd say early on, back in 2011, 2010, we really began with the access piece. There's a lot of work that needs to be done still in not only getting the healthcare system online, doctors using EHRs. ONC and CMS have made tremendous progress in that in the last few years. We're up over 70% of providers and something like 90% of hospitals are already working on meaningful use or already have implemented it, so this is great. But more data needs to flow, particularly to patients. But that work is well underway and it continues on. On the action piece, we've really delved into, again, building these standards, getting adoption of them, working with the private sector to use them. I think it's very exciting that we've seen a lot of major consumer companies jumping into the healthcare arena just in the last maybe 6 months, talking about Google, Samsung, Apple, Philips. I went to the Consumer Electronics Association show last January. It was amazing. Suddenly there was this like growing interest in health and healthcare, whereas they used to be all about like TVs and cars. So we are getting the private sector to help more actively and non-traditional parts of the private sector to help solve these problems with us. The other thing, the attitudes piece, the last of the 3 A's, I feel like in our efforts at ONC and the federal government, we're just at the point of starting to address those. And we chose this order deliberately. We didn't want to push too much consumer education and demand when providers weren't ready to share information, when the ecosystem wasn't in place. But I feel like we're at the place right now where we really can start to run things like that public service announcement that I showed you and get people to start asking doctors, health plans, and others, how do I get my information and what can I do with it? So we're right on the cusp of kind of filling out that third A while continuing to push on the first 2. Whoops. Hang on. All right, looking ahead. So I should say this is actually really my last day in a lot of ways at ONC. It's been an amazing 3.5 years there for me, but I'm passing the baton on to some amazing colleagues who will continue to carry this work forward. They're going to have a big summit in Washington, D.C. on September 15th, and they'll be talking about and carrying on a lot of this work and also sort of seeding some new directions. So this is very exciting. And they are continuing to seek your input and collaboration. Again, all of this work that we've done to date and that ONC will do in the future is really based on input from folks like you who care about this and who are helping to actually make it real. So thanks very much.